Hi there.
How are you?
Good. How are you doing?
Good. Thanks for meeting with me this evening.
Yeah, no problem. I guess what part of the country are you in?
I am in Kokomo, Indiana.
Oh, wow. I knew you were in Indiana. I didn't know where.
Yeah, it's called Kokomo.
Oh, that's pretty cool. I'm in
Yeah.
San Diego. Not as fun, but fun of a name, I guess.
Oh, San Diego's beautiful though. I lived in Santa Barbara in the 90s, so
Oh,
uh,
nice.
yeah, pretty place. So
Yeah.
yeah, absolutely. But yeah, thanks for reaching out. I'm always wanting to talk to people about infants, about anything really, but infant.
Yeah.
So yeah, I'm curious to see what's going on.
Awesome. Do you want me to just share on our research, the
Yeah,
company, however
yeah.
you like?
Yep. Well, let's do it that way. And then what I'll have you do as well is on the email, just send me whatever you want me to put in the description and the bio, because I usually do a little thing at the very beginning, like a kind of a
Oh,
bio. Um,
okay.
yeah,
You
and
want me to do that now or afterwards?
you can do it
Okay.
afterwards. It's fine. And
Okay.
then that way I can just get that on there for you as well, with
Okay,
any
great.
information that you want people to know. So
Okay, great. Thank you.
yeah,
Okay.
yeah. So yeah, let me tell me all about what you're doing out there.
Great. So yeah, I'm Stephanie. I'm the co-founder and CEO of Persephone Biosciences. So I am a scientist by training. I started this company with my co-founder 9 years ago, been focused in microbiome research, initially to develop cancer therapeutics for the gut. Because having an unhealthy microbiome impacts how cancer patients respond to treatment. And the ability to change that could impact how, we have better cures, and more people could respond to cancer therapies. And I was focused on that for many years. And then I had a little one who now is 5, Elizabeth. And after when she was about 6 months old, I had a conversation with a leading pediatric scientist who came to me and said, you're fixing the gut microbiome of cancer patients. Why don't you think about doing that for babies? And that's what got me on this journey because I was very upset, obviously, by this conversation because my daughter was COVID. She was sitting off camera, sitting pretty close to me, and what's wrong with my daughter. But also, I'm a leading scientist, and I really didn't know the problem that he was talking about. And this turns out this is a problem of modern babies. Didn't impact our grandparents, doesn't really impact the babies of the Amish, other non-industrialized populations. It's modern babies because of practices like C-sections, infant formula use, poor diet. Um, Antibiotics is a big one that we think contributes. And as a consequence, babies are missing or tend to have not enough of the right bacteria in their gut that trains the immune system. That's actually the role of the early gut. And when you don't have these right bacteria, essentially the wrong bacteria take hold and the immune system develops errors. And these errors end up being permanent. And it leads the child to being at high risk for getting food allergies, eczema, asthma, atopic disease conditions. We also think it's linked to many other conditions. And so I wanted to better understand this problem, but I also wanted to fix it because there really hasn't been any products that could address it. I also, when I looked around the world at research that's been done, there's a lot of research, about 10,000 scientific publications talking about the infant microbiome, most of which was not in the United States. So large studies were done outside. And so I wanted to, one, better understand what was happening here in the US, but also to develop a product. I wanted to get enough data to do that. And so we launched the My Baby Biome study almost 4 years ago. The children are almost 4 now. And what we found is largest ever in the US to map the baby biome. So a lot of dirty diapers and baby poop, thousands of samples. And what we found, and we published it in Nature Journal last year, what we found was that 9 out of 10 US babies are missing these key, one or more of these key bacteria. They're called bifidobacterium. These are very special bacteria because They thrive in the presence of prebiotics found in breast milk, what are called human milk oligosaccharides. They don't really feed the child. These oligosaccharides feed the bacteria, these bifidobacterium. And when they get fed, these bifidobacterium produce special metabolites or signals that tell the immune system to develop properly. They also produce a lot of acid that basically suppresses any of the bad bacteria. So it's a win-win for the child. And that's what we found. By age 2, this is where we saw the health outcomes. As they became toddlers, we saw that those children that had low or no amounts of these key bacteria, bifidobacterium, were 3 to 4 times more likely at developing these atopic disease conditions. And so using AI on our data, we were able to discover that there were really 3 important key species of bifidobacterium. Bifidobacterium infantis, longum, and breve that are really important for immune development. And so we've developed a product from our lab here in San Diego, 30 feet away, essentially that we isolated many strains of those key bacteria and developed a formulation that we've commercialized about 9 months ago, direct to consumer for parents, completed a clinical trial, are now publishing a study on it. Also the largest study to look at pre and probiotics in infants and toddlers. But really excited about the opportunity of correcting this in young children.
Yeah, absolutely. I see it a lot. Of course, I'm a lactation consultant,
Yeah,
so I
yeah.
do see a lot. But it's been curious to me. I've kind of looked into a little bit of research on it because more and more moms are starting to breastfeed, but more and more babies are having eczema and allergies. And then I thought, well, maybe it's because our breast milk isn't as healthy. I mean, I don't want to say that,
Y-
because our foods aren't, you
yes,
know.
yes,
And so
yes.
then it's kind of like, okay, like you said, where do you begin?
Yep.
With that.
Yeah. And that's what we saw in our study, which was interesting, was those babies that were missing these bacteria and were breastfed. If the good bacteria are not there, the breast milk unfortunately feeds sometimes the wrong bacteria. And
Hmm.
so I think of it like a garden. These probiotics are the right seeds, right? And breast milk can provide the water, the fertilizer essentially. And if you don't have the right seeds in place, you're going to get weeds. And that's kind of what happens. And so it's kind of the two have to really come together for it to completely happen in the gut. Yeah.
Yeah. I mean, it's amazing because that is one of the things that I've noticed in the last few years is
Yeah.
a lot more issues with babies. So, with what you guys have, the pre and probiotics and stuff,
Yep.
does it work similar whether they're a breastfed baby or a formula fed baby?
That's a great question. So this is the product
Okay.
for infants and toddlers. It's a powder. Yes, so it should work for every baby essentially. That's why we designed it. It has the probiotic strains that we discovered, but also the HMOs, the prebiotics from breast milk at a pretty high dose, about a gram, a little over a gram actually. And that should work regardless if they are formula fed or breastfed. And that's what we validated in our clinical trial called Artemis.
Okay, good. So when parents reach out for this, is it for
Yeah.
most of the time, is it, reflux problems, you know, just those
Great
kind of
question.
things?
I think it's a combination of things. So what our studies are really sharing, and I didn't really understand this until I got into the space myself and as a parent, the microbiome of a child is developing significantly over the first 3 to 4 years of life. It starts out with maybe a dozen microbes. And
Mhm.
by the time that they're going into kindergarten, there's several hundred. It looks much more like an adult microbiome. It's not fully there, but pretty darn close. And so these bacteria are really critical throughout that whole development. So you basically want to be taking it as long as you can, to support that development. And we know antibiotics, children, unfortunately, at the age of 2, quite a high percentage in the US take antibiotics, something we can't really avoid, especially when they have an ear infection. That really kind of resets the microbiome. So it's really important that we have those probiotics there for when something like that happens The other thing is that we've noticed is from pediatricians and from parents, and future clinical studies will work. We've seen a reduction in colic. We've seen just improvements in GI digestion, regularity, mood, appetite, diaper rash goes away. That's really the mechanism. If you have an acidic microbiome, which these babies should, you should see a reduction in diaper rash. So it really does work all of those situations as well.
Okay. And then for the birth of the baby, so can you kind
Yeah.
of explain a little bit between the vaginal delivery and the C-section and how that changes the microbiome?
Great question. And a lot of modern sequencing techniques have allowed us to really understand that. So when baby's born vaginally, of course they're getting the microbiome of the birth canal, but they're really getting their mom's gut microbiome. So essentially a little bit of stool is seeding the child as they're coming out. And that really becomes the beginning of their gut microbiome. So their microbiome looks much more like mom at birth. This is in contrast to C-section because that's a surgical procedure. Antibiotics are provided, but the baby is then their first microbiome is actually from the hospital and
Okay.
then the skin of the family members. So very different ecosystem.
hmm we try, I don't know how it is out in California and Indiana. We try to do the skin to skin at the very beginning. I know some
Yeah.
hospitals are doing it, some aren't, but it's like, it's so important to get that.
Absolutely,
Yeah.
as quickly as possible. And even the vernix and all these things that the baby is born
Mhm.
with, we want to preserve some of these things. So I think a lot is, we've learned a lot, I guess, over the years on these practices, but really trying to maintain the microbiome is actually really important.
Yeah, absolutely. Um, I was going to ask you something else. Are there did you find anything? I don't know how much you looked into like mom's diet, but are there
Mm.
things that are just moms really should avoid those things during pregnancy or breastfeeding, or did you kind of get into that at all?
We do, and we also think about birth mode, because we wanted to understand how was mom born, because this is actually multi-generational. Moms can pass on microbes, right? And so that's something we're really interested in understanding. I would say, there isn't anything we found that's like really negative, but how moms should be thinking about it is really what can I do to diversify my microbiome? Because especially if the baby's going to inherit some aspect of your biome. So thinking about as much fiber as you could possibly eat, I think exceptionally important, as well as fermented foods.
Yeah, that makes a lot of sense. So if the parent has to take an antibiotic, the baby has to take an antibiotic, is it a good idea just to follow it up with a probiotic anyway? I mean,
Absolutely.
okay.
Absolutely. Yeah. I mean, there's a lot of studies that are demonstrating the impact of antibiotics and the resulting infant microbiome.
Okay. Yeah, that makes a lot of sense. Um, I'm trying to think of some good questions for you.
Just kidding. These are great.
It's like, what's coming to mind here? Um, I'm trying to think. Is there anything else you want to add while I'm trying to think here? How about I've seen a lot of babies with GERD and
Yeah.
reflux. Doctors put them on medications right away. I'm always thinking that, probiotics are probably a better start, but I never want to go against the doctor, so I always just kind of,
Absolutely. I think, as we think about it, these particular types of bacteria that I've been discussing this in our study, these are like essentially what Mother Nature intended. These are natural, right? These were inside of us. Thankfully, they're still inside of some of us, right? And we're putting that back. We do think that that is really associated with a lot of discomfort in these babies, and may play a role. Sometimes there is a clinical diagnosis that definitely needs to be addressed, but something like this can maybe reduce some of the discomfort for the child. So I would definitely consider that as a first natural option for sure.
yeah, because parents always want the natural option first. They
Yeah.
kind of want to know how can we because then nobody wants to be on medicine. Adults don't.
No,
They don't want to put their
no,
babies
no,
on
and
it either.
especially such a young child.
Yeah,
Yeah.
exactly. Um, are there are there any, let's see, how do I want to put this? Are there
Yeah.
any like myths or anything like that that you've heard that you're like, that you kind of want to talk about, that maybe misconceptions about something when it comes to adult
Yeah,
milk?
I think it's learning, all of us, um it's modern life is impacting this. Our babies are perfect, absolutely, but modern
Hmm.
life has just impacted some aspects of them. And I think there's this misconception that even vaginally born breastfed babies are completely fine. And unfortunately, we're finding that's not the case because they're missing these key bacteria. And so, with that in mind, I think it's really important. Our goal here is that it becomes standard of care. Again, it used to be part of all of us. We're just trying to make sure it gets back into the ecosystem. So that would be my that's the myth that I've been seeing. And also, as we discussed, breastfeeding alone is insufficient in many cases.
Yeah. And like you said, it's funny because that's one of the things I've noticed, because you're taught in school, you're just like breast milk is the best and your baby's gonna have the best immune system. And then I see these babies and I'm like, but wait a minute, these babies are having issues,
Of course it is. I mean,
you
it's just
know?
not going to be, those breast milk prebiotics won't be feeding the bacteria. So the right bacteria is the thing. And many of it will get wasted. But there's all these antibodies and all the other things in breast milk that are absolutely important for the immune system to develop. But it's one component. It's just the microbiome side.
Yeah. So we were talking about infants, so then we talk about toddlers. Toddlers start to get more foods, as they get to that
Yeah.
point. So you had two different things, right? You
Yep.
had infant and toddler.
Infant and
Okay.
toddler. Yeah.
Okay. And then what would you consider, um, is there an age where you think that they get it? You have the infant and the toddler. Is there an age where you're like, okay, by this point, if they're using these products, that their gut biome is going to be balanced out like it should?
Yeah, I mean, really, I take the toddler product. Many adults do until we get a adult product. But we say, ages 1 through 3 plus, essentially.
Hmm.
And I think, for younger children, this is a great product. And of course, for adults, we will, because our My Baby Biome study is a 7-year study, we will be coming out with a more sophisticated product for children.
For sure.
Very, very similar because these are still the critical microbes for everybody. But yes, this is great during that early infancy through childhood, I would say through preschool, essentially. Yes.
Okay. And then it looked like it was a powder. Is it a once a day?
Yeah, it's a daily powder. It's quite light, easy to dissolve. It's flavorless.
Okay.
So what's great, and then also for babies that are exclusively breastfed, moms can add it to their chest. They can make a paste with their finger, some breast milk, and put it in their child's mouth. So it's really easy to use. Just depends, how you're feeding your child.
Okay. And so then if parents are interested in this product, how do they go about getting it from you?
That's great. Our website is Persephone.bio. We're also on Amazon
Oh,
if they're
okay.
interested. Then that's the best way. And they could also follow us at Persephone.bio on socials.
Oh, nice. Okay. Yeah, is there anything, um, I'm trying to think, is there anything else that you want to add to it?
Um, Not necessarily.
Okay.
Yeah, I'm just
This
thinking
was
in
great
terms of
information.
lactation practice, how you guys recommend
Yeah. Well,
these
we're always
things.
trying. I mean, for
Yeah.
me, I'm always trying to find something.
Yeah.
When parents breastfeed, they want to find the natural stuff, and you try to do the research, and they talk about gripe water, and they talk about,
Oh,
they do talk about, I know, probiotics, but it's like,
yeah.
okay, what do it's like, oh, what do you
That's
use?
that's why we did this. We're actually partnering. Maybe something to add is that we're partnering with over 500 pediatricians across the U.S.
Oh, nice. Okay.
And so we're hoping to scale over 1,000 by the end of the year. So, and we've been really active at the meetings at the American Academy of Pediatrics. We are partnered with some of the leading physicians in the country. So, in addition to obviously our big research that we're doing. So, this is something, I wouldn't do anything as a parent that I wouldn't like want every other parent to be using, if that makes sense. I also feel frustrated about like, does any of these things work? The other thing to note actually is that we're the only product of its kind, a pre and probiotic symbiotic, to receive the Clean Label award, Clean Label project. So I think that's really important, especially for parents if they don't know, if they're trying to make decisions. That is an important third party assessment on really clean ingredients.
No, absolutely, because they want to know what's in their products before they give it to their
Exactly,
infants.
exactly.
And I do too. As a lactation consultant, I didn't want, I
Yeah.
don't want to talk about something if I really don't know it that well. And
Exactly. You must see a lot of clients or in patients in person, right?
yes, all of mine are in person.
Would you be interested in giving out samples or being in our
Absolutely.
program? Okay.
Yeah, absolutely.
Yeah, if you want, so we give practitioners essentially this goes to the patients, but we give everybody a 7-day starter pack.
Oh,
So this is
nice.
for
Okay.
infants. Yeah.
Hmm.
So
Yeah,
if they're
absolutely.
interested in a 30-day supply, they can come on the website or whatever, but this should get them started.
Okay, yeah.
But
Because that's a good start, and then they'll know whether or not it's something they want to do. And yeah,
exactly, exactly. So, and love your feedback. We'll send some out to you. Just share
yeah,
your address and, yeah, would love your feedback on how it goes with your patients.
yeah,
Yeah.
absolutely. Because I'm always trying to find stuff. When you reached out to me, I was like, oh, this is definitely something I want to talk
And
about.
that's why I wanted to connect more with lactation consultants. I had a hard time with my daughter feeding. We learned about a tongue tie. I didn't even know those really exist. Uh, Unfortunately, we found out like you got rid of it at 2 weeks.
Yep.
So very frustrated. I don't even want to go there and the memories and the frustration, but on the pain too. I didn't even know that even existed. So
Yeah,
so I'm with you on that. But and so I'm thinking about my own journey, and I was just thinking how important it would have been if somebody had told me that I need to do this, especially because lactation support happens at such an important time.
yeah,
Yeah.
absolutely. I found out my son was tongue-tied at 15 when he had sleep apnea, so don't feel bad.
Oh, okay, okay.
Yeah. Yeah, and I could not nurse and I couldn't figure out he just there was
Wow.
all kinds of issues in infancy and
Yeah.
transitioned all the way till he was a teenager and then he was diagnosed with sleep apnea and the first dentist who looked in his mouth, she goes, "You realize he's tongue-tied, right?" And I was like, "No, nobody had ever said anything."
Yeah.
And I'm a dental hygienist by trade. We
Wow.
never learned we that's not something we learned in school. It's not anything
Yeah.
we learned to look at.
Yeah.
So
Wow.
that began my journey into lactation because I wanted to go back to the begining. And
Yeah.
yeah.
Yeah. I know it's interesting how we all take this journey. I mean, literally, I never thought I was going to be working with baby poop. Like
Until you had a baby.
until I had a baby, there we go. Then it was like, oh, well, you work on other people's poop. Why don't you work on this? I was like,
Yeah.
okay.
Yeah. And
So,
actually, I think it's wonderful because there's always questions, you know. So talking about certain things, I mentioned gripe water and stuff, and the stuff people go through, you know, people do like yogurt, you know. I mean, there's all
yeah.
these things that people try, but it's really not. Like you said,
No.
you really just have to get the gut health
You do. It is,
into
and
it.
it is really important. This connection to food allergies is really significant in dermatitis because as you're introducing allergens, which you're supposed to around, 4 to 6 months, if you don't have a healthier microbiome, again, that's putting the child at risk, much higher risk for getting those allergies. So it's really important to have that background.
Hmm.
And we see that between 4 and 6 months of age, that's when, again, the microbiome takes a huge shift. Food introduction of solid foods shifts it completely. So if you don't have the right bacteria there, it's actually going to continue to stay on that like poor journey.
Yeah.
Yeah.
Now, I've had a lot of not a lot, but I've had several babies recently that the doctor has told the parents they think they have a milk allergy and they're young, they're 2 months old or whatever. And it's probably more gut related than it is actually. They're breastfed babies, you know what I mean? It's probably
Yeah.
more gut
Yeah,
related.
that's what we think too. Some of the pediatricians that we partner with have seen some great, some improvements with babies who had cow milk protein allergy.
Hmm.
But I definitely think that that's kind of the sensitivity we're seeing as well. Yeah.
Yeah.
And
Yeah.
it's definitely worth a try again. I would try. I mean, it's natural, it doesn't
Yeah.
matter.
Yeah.
So,
Yeah. I
um,
mean, try it. And if it works, great. I mean, that's, it's positive
yeah.
for you.
Yeah.
Yeah.
So I'm happy to send samples. Love for you to be in the program, but also to keep in touch if there's anything that
Yeah.
comes up. Again, we're trying to like just spread the word, even if
Absolutely.
there's in your network, if there are pediatricians or other parents want to learn more, I'm here. I'm a resource.
Okay. Yeah. Yeah, absolutely. And I'll get this edited and get it out.
Right.
I'll get it on my podcast, but I also have a group of natural practitioners here in Indiana. I think there's like 25,000 people on this group. So
Wow.
I
Oh my
know
gosh.
it's amazing. It's an amazing group. So I will get it out to them as well.
I
So
would love that.
yeah,
And I would be happy again to connect with any of them. Let them
absolutely.
know. Yeah.
Yeah, I'll give your information and I'll put it on the link to the podcast so that we can get a hold of you. And yeah, I
Great.
mean, this has been amazing. It's answered a lot of questions. Is it those questions that you kind of know in the back of your mind, but I'm like, somebody needs to just tell me.
It's amazing how every time listen, I didn't know this either until I got into the research. I got really into it,
Mhm.
obviously, but I didn't know either. But every time I connect with some leading pediatricians, they're like, yeah, I thought so, but I didn't know, like
Yeah.
I've seen like, eczema double in the last like decade. So like
Yeah.
but and all the GI, they're like, I've never seen so many fussy babies.
Yes.
That's what they've said to me. And yeah, and
And they're breastfed babies, and it's just like,
yes.
what is this? Now it's funny, earlier you talked about Amish. Here where I live, we have a
Yeah.
large population of German Baptists. And
Ah,
they're the healthiest. I mean, I'll go see them
yes.
if they have a tongue tie or something, but those
Yeah.
babies are always healthy. And I know it's just their food. I know it's because they grow their own food. They know
Yep.
what food sources are. They're basic when it comes to, what they eat and, what they
They
do.
don't really get exposure to antibiotics. I
They
mean, unless
don't.
it's something, that they have to
Yeah.
go for a procedure or something. So yeah, they don't have any of these things. They're
No.
not exposed. And that's how we used to look. That's how our microbiome used to be. I mean, we have data from 100 years ago in the United States. I don't know why they were looking at baby poop, but somebody put baby poop under a microscope and saw it was all bifidobacterium. So
Yeah.
that's how it started, but
Okay.
it was all that. So we know we've changed.
Yeah.
Yeah.
Well, and like I said, I've seen a couple small things with breast milk about how the consistency's changed and the vitamin
Yeah.
content's changed and everything. And that makes sense. If you grow fruits and the vitamins in those have changed 50 years,
Yeah.
our soil's different, it's just there's a lot of
Exactly.
factors there.
Yeah.
So, but yeah, it's been really interesting. Thank you
Thank
so
you.
much for reaching out, but
Thank you. I will,
yeah.
so I'll follow up with my bio and then that's all you want, or did you want a headshot? I'm sorry.
No, because I just do
No.
the audio right now.
That's fine. Yep.
Yeah,
Okay.
I'll put this video on my YouTube page. Because some people have wanted to see the video because they want to see the people that they hear on the podcast. So I do
Okay.
that, but
Okay.
I just,
Great.
yeah.
Sounds good.
But look at me, I'm in my office. I'm just like, it's fine.
Yeah. This
It's
is
all
my
right.
office. So,
Yeah. Yeah.
okay, great. And then send me your address and we'll go from
Yeah.
there.
Yeah,
Awesome.
absolutely.
Oh, when do you think you'll put it up? I'm sorry.
I'm gonna work on it. Probably I'm gonna get it on this weekend.
Oh, okay,
I
great.
find that I get more downloads on my podcast over the weekend. So,
Oh, that's
um,
nice.
yeah, Saturday and Monday, Tuesday are kind of the 3 days that get the most downloads. So, yeah.
Oh, that's awesome.
Yeah.
Okay.
So, but yeah, and then I'll get it on that other site as well, the site that I'm on. And yeah, there's quite a few people on there. So, hopefully some
That's
people will
great.
reach out to you.
Yeah, thank you. Really
Yeah.
appreciate it.
Yeah, well, thank you so much for meeting with me.
Yeah,
It's been a pleasure. I've enjoyed
thank
it. If you
you.
have anything else you ever want to talk about, let me know.
Okay, will do. Have a nice
Awesome.
evening.
Thanks, you too.
Thanks. Okay,
Bye.
bye.